Hello, I'm Mr. Vikram Dhar. I am an ENT consultant surgeon based here at the One Ashford Hospital in Ashford, Kent. A feeling of something in the throat or globus is an incredibly common symptom, and the vast majority of the time it's nothing to worry about. A lot of people come to me worried that they may have cancer, and as a symptom alone it isn't too concerning. Certain symptoms such as difficulty swallowing, so food actually getting stuck in the throat, or ear pain associated with it, or lumps in the neck associated, are concerning, and you need to go straight to your GP. Now, getting on to why people actually get a feeling of something in their throat. Apart from the small group of patients that have something concerning, I would say this is categorised into two main areas. One is that of what one would call reflux, related to the muscle at the top of this food pipe, the esophagus, getting tight. People often say that they feel that there is a lump in the throat or a ball in the throat, just at the lowest bone of the larynx, just here, the cricoid bone. If you press there, just in that area. Often it's related to stress also, so it's really important for people to think about what they're eating and drinking, reduce any acid-provoking foods, not eat too late, perhaps try to lose some weight if they're overweight, and try to reduce their stressors, and that can help. And then there's a second group of patients that are what I call the chronic throat clearers, patients that have that feeling there's something there and they throat clear to try to make it better. And actually what they're doing is they're buying into a vicious cycle. Patients will feel that there's just something entering the larynx, and the voice box, the larynx, the whole function of the larynx, one of the functions at least, is to prevent food and drink going into our windpipes. So when it feels there's a little bit of an irritation there, for whatever the reason, whether it's an infection or whether it's acid, it will encourage you to throat clear to get rid of it. And when one does that, it's a bit like slapping the back of your hand. It makes it more irritated, the larynx gets more sensitive and wants to throat clear again, and thereby triggers this vicious cycle. And those are the sort of, it's really important in that scenario to try not to throat clear, to take sips of water and dry swallow. But I think the main message here would be to look out for the worrying symptoms, go to your GP if you are concerned, come and see someone like me if you would like here at Ashford 1, but try those two techniques that I mentioned, looking at your amount of acid that might be coming up, attending to that, but also if your throat clearing, really try to break that cycle. That's absolutely crucial.